If you don't remember my story, at least remember RIGHT. I for inspiration. But back in the day when we didn't have all those things, what do? Maneuvers. And the boards still will ask you maneuvers. So how are you going to differentiate between a mitral regurg, tricuspid regurg and a VSD? If you don't remember my story, at least remember RIGHT. I for inspiration. And on left side, blood flow increases on expiration, because the opposite should happen, right? So if I do inspiration, out of these three murmurs, which murmur sound should go up? Tricuspid regurg, because I'm increasing flow through the right side, right? So inspiration, your tricuspid should go up, easy. Which one should not change on inspiration or expiration? VSD, because even if you bring blood more here or there, it does not affect the blood flow through the VSD. It stays constant. Again, not as unique as a pansystolic murmur that doesn't get affected by inspiration, expiration.